Hey, this is Dr. J from the Center for Total Back Care. Today, what I want to do is talk to you about proper sleeping postures. So, this is Tessa, by the way. She's here to help us out. First thing I need to have you understand is a concept called maintaining the normal curves before we get into that. And that includes any normal activities of daily living that you do, you want to maintain the normal curves. And what I mean by that is if we look at her spine, this is the cervical curve, this is the thoracic curve, lumbar curve, and sacral curve. And it's important to maintain those no matter what we do, because it's usually at the extremes of motion where we get injured. Either we're bending forward and we lose that lumbar curve, or we're bending back and we hyperextend it. So the first thing we're going to do is we're going to look for this, maintaining these normal curves while you're actually working on these postures. So first thing we're going to show you is on your back. So she's going to lay on her back, and you just want to look. Generally, people sleep like this, and you can see their head is a little higher. And so what I like to do is have my patients just drop it down. So now you can see she has a normal cervical curve. And then I like a pillow underneath the legs, and that helps reduce the pressure on the low back. Okay, the next one is side posture. So she's going to lay on her side, and that bottom arm should go up. We're going to put a pillow between her knees, and we want to make sure that it goes down to her ankles too, because this puts less stress on the spine. And then you can do another pillow or a blanket or something like that, just to rest your arm on. Okay, and the last one I want to show you is sleeping on your stomach, which is probably, well, without a doubt, is the worst way to sleep. But some people, this is the only way that they sleep, and they like sleeping like this. So you can kind of see that her low back is hyperextended. What I like is to have you put there, okay, and even bring your arm over just a little bit, okay, and that'll take some of the stress off the low back. So again, if you're waking up because of back pain, because you're a stomach sleeper, you need to change the way you sleep. And how you do that is you put maybe the thread spool or some other item to your chest. So when you lay on your stomach, it'll wake you up and you can change positions. And usually you can retrain yourself after a couple weeks. So hopefully these will help, and hopefully you'll be able to sleep a lot better. So sweet dreams.